Welcome to G Fun Facts Online. When we think of a pediatric intensive care unit, or PICU, we often picture a story of triumph, a sick child, the beeping of monitors, and finally, a miraculous recovery. And in many ways, that story is true. Thanks to incredible medical advancements, survival rates in many PICUs are now above 95%. But what happens after the hospital doors close? The battle for survival might be won, but for many children and their families, a new, silent struggle is just beginning. This is the story of post-intensive care syndrome in pediatrics, or PICS-p, the unseen toll of a critical illness. It's a complex web of new or worsening problems in physical, cognitive, and mental health that can follow a child for years. And today, we're going to pull back the curtain on this surprisingly common and life-altering condition. Some studies show that over 80% of children discharged from a PICU have at least one new or worsened health impairment. Let's break down what that really means. The first domain of PICS-p is the physical. While you might see a scar from a surgery, the deepest physical impairments are often invisible. The most common is something called ICU-acquired weakness. Imagine being confined to a bed, often sedated, while your body fights a severe illness. This prolonged bed rest, combined with certain medications and the body's own inflammatory response, leads to significant muscle atrophy and even nerve damage. For a child, this isn't just about feeling weak. It can mean struggling with the most basic motor skills, like sitting up, walking, or even holding a toy. Hand in hand with this weakness comes a profound fatigue. This isn't the normal tiredness after a day of playing. It's a bone-deep exhaustion that can be triggered by minimal effort, like eating or just sitting up. Some reports indicate this overwhelming fatigue affects up to 63% of PICU survivors. Many of these children also develop feeding difficulties. This can happen for a few reasons. The muscles used for swallowing might be weak, or a child who is on a ventilator might develop an aversion to having anything in their mouth. This can lead to poor nutrition, growth delays, and sometimes the ongoing need for a feeding tube. On top of this, many children are left with chronic pain, stemming from their illness, multiple invasive procedures, or nerve damage. And then there's sleep. The ICU, with its 24/7 lights, noise, and interruptions, completely wrecks a child's sleep-wake cycle. These disturbances, including nightmares and insomnia, don't just disappear at discharge. Studies have reported sleep problems in as many as 80% of young survivors, compounding their fatigue and emotional distress. All these physical challenges can delay a child's return to school, their ability to play, and their path to achieving normal developmental milestones. But the scars of a critical illness are not only physical. They can cast a long, cognitive shadow, hindering a child's ability to learn and develop. The developing brain is exquisitely vulnerable to the insults that come with critical illness, like lack of oxygen, inflammation, and the heavy sedatives required to keep a child comfortable and safe. One of the most significant cognitive impacts is on what's known as executive function. These are the high-level mental processes that allow us to plan, focus, remember instructions, and juggle tasks. Children with PICS-p often show deficits here, leading to problems with organization, problem-solving, and self-control. Memory is also frequently affected. A child might struggle to remember what they learned in school before they got sick, or have difficulty retaining new information. Some even have frightening delusional memories from their time in the ICU, while having no memory of the real events. Attention deficits are another common complaint. Children may become easily distracted, unable to concentrate in class or finish tasks that require focus. Their processing speed, the rate at which they can take in and respond to information, can also slow down, making it hard to keep up in conversations or in the classroom. In some studies, pediatric ICU survivors have even shown lower IQ scores compared to their peers. Even a minor drop in cognitive function is significant, as it's a major factor in a person's long-term quality of life. Some of these issues may resolve in the first year, but for others, they can persist for years, or in some cases even get worse over time. Beyond the body and the brain, a stay in the PICU is a deeply traumatic event that can leave invisible emotional wounds. The fear, the pain, the total loss of control, these experiences can result in serious mental health challenges. Post-traumatic stress disorder, or PTSD, is alarmingly common. For children, the rates of post-traumatic stress symptoms can be as high as 62%. They may suffer from intrusive memories of the ICU, nightmares, flashbacks, and a state of constant high alert. They might avoid anything that reminds them of the hospital. Anxiety and depression are also widespread. A child might develop intense separation anxiety, specific fears related to their illness, or symptoms of depression. One study found that over 83% of children self-reported symptoms of depression after their PICU stay. The long-term picture can be even more concerning. A nationwide study in Taiwan found that children who survive an ICU stay have a significantly higher risk of developing major psychiatric disorders later in life, including schizophrenia, bipolar disorder, and major depressive disorder. Some children also develop new behavioral problems, like hyperactivity or aggression, which are often outward expressions of their inner turmoil and inability to cope. This journey can fundamentally alter a child's self-esteem and identity, leaving them feeling different from their peers and struggling with changes to their body image. Now, while any child who goes through a critical illness is at risk, some are more vulnerable than others. Younger children, especially infants, are at higher risk for cognitive problems because their brains are developing so rapidly. Children with pre-existing conditions, like neurological disorders, are also more susceptible. Unsurprisingly, the more severe the illness and the longer the stay in the PICU, the higher the risk. A stay of just 4 or more days has been linked to a higher rate of cognitive impairment. Other major risk factors include the need for a mechanical ventilator, the types and amounts of sedative medications used, and the development of delirium, an acute state of confusion that is a strong predictor of poor cognitive outcomes. But the story of PICS-p doesn't end with the child. A child's critical illness is a crisis that sends shockwaves through the entire family. This is known as PICS family, or PICS-F. Parents of critically ill children are at an extremely high risk for their own mental health crises. The stress is unimaginable. As a result, a significant percentage of parents develop PTSD, anxiety, and depression. One meta-analysis found PTSD was diagnosed in up to 48% of parents in the months following their child's PICU admission. Another large study found a staggering 110% increase in new mental health diagnoses among parents in the 6 months after their child's hospitalization, with mothers being particularly at risk. This emotional toll often shows up physically, with parents reporting fatigue, headaches, and a general feeling of being unwell. They grapple with guilt and helplessness, and many live with a constant heightened fear for their child's safety, long after the immediate danger has passed. And let's not forget the siblings, often called the forgotten grievers. Their world is turned upside down. Routines are shattered, and parental attention is almost entirely focused on the sick child. Siblings often experience intense fear, jealousy, and sadness, and may have behavioral changes as they struggle to process what's happening. Then there's the financial fallout. Even with insurance, the burden can be crushing. There are out-of-pocket medical expenses, but also the non-medical costs: travel, parking, meals, and lodging near the hospital. All of this is compounded by a loss of income. It's common for a caregiver to miss work or even quit their job to be with their child. One study found that, on average, work absenteeism across a family added up to 78 days. This perfect storm of increased expenses and reduced income can lead to delinquent debt and destroyed credit scores, adding another layer of intense stress to an already traumatized family. This brings us to a crucial point. If we know this is happening, what can be done? The good news is that the medical community is actively developing strategies to prevent and manage PICS-p, and it starts right inside the ICU. Many of the risk factors we discussed, like sedation, delirium, and immobility, are modifiable. A key strategy being adapted for children is called the ABCDEF bundle. It's a set of evidence-based practices that have shown great results in adults. Let's quickly go through it. A is for assess, prevent, and manage pain. B is for both spontaneous awakening and breathing trials, which means safely reducing sedation daily to see if a child can breathe on their own, reducing time on a ventilator. C is for choice of analgesia and sedation, focusing on avoiding drugs that are known to cause delirium. D is for delirium, assess, prevent, and manage. This involves regular screening and using non-drug interventions, like promoting normal sleep cycles and reorienting the child. E is for early mobility and exercise. As soon as a child is stable, getting them moving, even just in-bed activities with physical and occupational therapists, helps fight off that devastating muscle weakness. And finally, F is for family engagement and empowerment, involving families in care, communicating clearly, and offering support is critical. It not only helps the child, but also helps prevent the family from developing PICS family. But recovery is a long journey that continues after discharge. A growing number of hospitals are now creating dedicated PICU follow-up programs. These are multidisciplinary clinics where a team of specialists, like neuropsychologists, physical and occupational therapists, and social workers, can screen for problems and create individualized rehabilitation plans for each child and their family. These plans might include physical therapy to rebuild strength, occupational therapy to relearn daily tasks like feeding, and speech therapy for communication or swallowing issues. For cognitive problems, rehabilitation focuses on strategies to improve memory and attention. And crucially, psychological therapies like cognitive behavioral therapy or play therapy help children and their families process the trauma, anxiety, and depression. The field of pediatric PICS is still relatively new, but there is a bright horizon of hope. Researchers around the world are working to standardize how they measure outcomes, conducting long-term studies to understand the full trajectory of recovery, and validating better screening tools to identify at-risk families early. The ultimate goal is to move beyond just survival. For decades, the metric of success was whether a child left the hospital alive. Now, we understand that's not enough. By recognizing the unseen toll of post-intensive care syndrome, and by focusing on a holistic, family-centered approach to recovery, we can work to ensure that these young survivors not only live, but are given every opportunity to truly flourish. The silence is breaking, and in its place, a chorus of action, research, and hope is rising. Thanks for listening to Fun Facts Online.